Hi, my name is Tyler Register, CEO and co-founder of Ataia Medical, and we're empowering patients with the freedom to speak. Our product was developed from a problem my co-founder, Dr. Ian Wong, has had since the beginning of his residency at Emory University, where he was completely unable to communicate with patients wearing non-invasive ventilation masks because they create a communication barrier between the patient and the outside world. This is a particularly big problem because it is the first line of treatment between patients that have respiratory failure. That means that these patients are completely unable to communicate problems that they may have, or questions that they may have with their treatment, or even medical history that could lead to a diagnosis. And this is why that over 50% of patients that wear these masks cite feelings of claustrophobia, isolation, and general fear. And these feelings are exacerbated by the current method of communication, the communication board. Now, this is a very common method to communicate with a patient, and it works how you would expect, where a patient is asked a question, and then they point to the most relevant picture that might answer that. Now, this is many times cumbersome, time-consuming, and completely ineffective. However, this is not just a patient satisfaction quality of care problem. Over $4 billion is spent every year in the United States alone on unnecessary intubation. And this is because 1 out of every 10 patients fail their non-invasive ventilation because they're unable to tolerate this mask. And when you fail non-invasive ventilation, you get intubated. What that means is a tube is stuck down your throat into your lungs to help you breathe. What comes with that is higher infection rates and a $28,000 price tag. We believe that if we can allow patients to communicate this valuable information to their caregivers and loved ones without hindering this life-saving therapy, we'll not only be able to create a better patient experience, but be able to produce better medical outcomes. And we at Ataia Medical have created a revolutionary device to do just that, the FTS communicator. This is a two-part device, the first of which is a small disposable patch that can go on the outside of virtually any hard plastic medical mask, where it will pick up the vibrations of a patient's voice and then send it to the reusable speaker component, where it will filter out the machine noise, amplify the patient's voice, so they can clearly and effectively communicate with those around them. Now, by doing so, we believe we'll be able to improve not only intubation rates, but create a more effective treatment and lowering the length of stay. And by doing that, we'll be able to save the hospital systems a potential $1.1 billion every single year. Now, unfortunately, there's 1.7 million patients in the ICU alone that have to go through non-invasive ventilation in the United States. And that's going to be our initial market because they have the most to gain for being able to communicate. After that, we see potential markets in the emergency rooms, long-term care facilities, and at home. Now, in the hospital, the majority of these patients have what's called COPD, a rapidly growing disease that the World Health Organization estimates will be the third leading cause of death worldwide by 2030. Our business model is pretty simple. We'll sell the microphone directly to the patient or the hospital at a high profit margin, and then sell the speaker at cost or even at a loss so that we can tap into the $266 million initial market. Now, we currently have a functional prototype and a provisional patent on that technology. We've also done market validation through user surveys of respiratory therapists and physicians that are intimate with this problem, and we've developed an experimental protocol that we'll put in place at Emory University to help quantify the savings that our device will bring to the hospital system. We've got a great team of founders working on this. Myself, Amy Furch, and Amber Jackson are all graduates of Georgia Tech's Biomedical Engineering program, and working alongside Dr. Ian Wong, a pulmonary critical care fellow and serial entrepreneur in the space. We also have an extremely experienced support team behind us. Notably, Dr. Eric Honig is the Director of Respiratory Care at Grady Hospital, and he's helping us with our clinical studies. And Dr. Andy Register is the Chief Scientist at Georgia Tech's Electronic Systems Laboratory. He's helping us with our product development. And Ken Block owns a regulatory consulting firm here in Dallas and is helping us with our FDA regulatory strategy. Looking forward, we're going to file our non-provisional patent and start engaging with the FDA by the end of the year so that we can hit the ground running in 2018 by conducting a clinical study through Emory and filing with the FDA through a Class 2 510(k) exempt pathway. After completing this, we'll order our initial product and launch to market hopefully by the middle of 2018. So once again, my name's Tyler Register with Ataia Medical, and if you'd like to help empower patients with the freedom to speak, we'd love for you to join our team. Thank you.